Loud. Hi, welcome back to our interview series. It's Erik Cole with the Design Studio for Community Solutions. We are thrilled today to be joined by a fantastic group of folks that are a part of the Viva Maryvale initiative, which does family-focused diabetes prevention and work in the Maryvale community. It's a great collaboration of a number of really engaged agencies, and we're thrilled to have all of you here today. Give me a hi. Awesome. So we're going to jump right into having the conversation. So I'm going to turn it over and ask you, Allison Williams, to kind of give us an overview of the initiative. Thanks for being here.
Hi, thanks for having us. And my partner in Sun Devil Pride, Arlene Fernandez Ramos, is with us too. So I'm a research program manager at ASU in the Edson College of Nursing and Health Innovation. And we have been working with St. Vincent DePaul and the YMCA for over 10 years to develop and test and to refine diabetes prevention programs for Latino youth and families that would be developed by the community, delivered by the community, in the community, for the community. And we really, our goal is to get these evidence-based programs and out of the hands of the researchers and into the hands of the community, for the community, where they can live and grow and be sustainable, right? And so we've worked together on NIH-funded projects funded by the Arizona Department of Health Services. And we recently got a grant through the Dignity Community Initiative grants, where we were able to also work with St. Joseph's Pediatrics, which is part of Dignity Health. And so the really cool thing about this grant is that it is not a research grant. It is not an ASU grant. It's a community grant with the YMCA as the lead agency. And it's an amazing collaboration that's now out of research into the community with the opportunity to be scaled across the community.
That's fantastic. I really appreciate that overview. So we've got a few questions. We're going to just move to the group, but folks, jump in as you're able to. So I'm going to turn to Leslie now, and Leslie, let you introduce yourself, but also kind of talk to us about how you got started in this work, and then what motivates your work in the community.
Hi, thank you so much. So I'm Leslie Larson, and I'm a pediatric nurse practitioner, and I'm representing St. Joseph Pediatrics, which is a primary care pediatric office, and we're part of Dignity Health. And one of the most important things for Dignity Health and St. Joseph Pediatrics, which is a long-standing pediatric office in the community, is just the importance of treating people with dignity. We're very focused on wellness and helping children and families, be all they can be and realize their dreams. And so in our primary care pediatric office, we always are thinking of partnering. We're, the old model of where the doctor tells this is what you do, that's so over the way gone. It's all about partnership. And so we want to partner with the child, with the family, with the community. And one of the biggest challenges probably in healthcare and wellness for young people at this time is just early childhood obesity and the long-standing and very serious consequences of having obesity or being at risk for obesity, and then proceeding into adulthood and then facing diabetes, high blood pressure, and other issues. So we're in a wonderful place working with children to try to turn this around. it's almost an epidemic. Speaking of pandemic, epidemic, it's almost an epidemic in our world and our society. And I think St. Joseph's is just really committed, especially to serving underserved. For many reasons, having obesity impacts underserved communities and children more. A lot of times it's access to safe places to play and be active and have fun. Thanks for the Y. They have a safe place in the community. A lot of times it's access to fresh fruits and vegetables or affordable foods that are convenient. And there's a lot of cultural norms and just a lot of familial traditions and practices that put these children and families at risk. So in our little office, when we see the families, there's only so much we can do. We are really so grateful for St. Vincent DePaul, for the Y, for ASU, for allowing us to find a way to extend our reach into the community and help connect our patients and families with these wonderful resources. And with these community partners, there are so many barriers, as we know, to every good thing, but we are really overcoming the barriers. So it's very exciting to be a part of this. I would say our whole office, the providers, the nurses, medical assistants, everybody is excited about this, and everybody's communicating to our patients and families. And just to have the hope of really being able to help these families in a meaningful way has been wonderful to be part of Viva. So
that's fantastic.
I was gonna say, Erik, could Elva tell a little bit more just about the program itself, about the 12-week program?
That'd be great.
Yeah, I'm Elva Hucker. I am a registered dietitian and a certified diabetes care and education specialist. I am the director of the Ivy Center for Family Wellness program at St. Vincent de Paul. And I have my colleague here accompanying me, Maria Silva, and she pretty much fits all those same titles, and she's our education program manager to get the introductions in there. Our program is essentially a well-rounded program. We're trying to really hone in on that word that Leslie used, wellness. It involves nutrition, it involves emotional health, it involves family functioning and physical activity, and that's one of the biggest reasons why we're all doing what we're doing is that we all found gaps and needs within each of our programs and the services that we provide. And although we would hope to be able to be the experts in everything, our partnerships really bring in the expertise in each of those areas. And when this program started back in 2000, originally known as the Every Little Step Counts program, those are really huge components that I think all recognize are very important because we saw the projection of what this could mean for chronic disease in our communities. So the current rendition of Viva is a 12-week program. They get a 1-hour weekly session of nutrition once a week. And in that nutrition class, we talk on topics about family communication, self-esteem, reading the nutrition facts label, dining and eating meals and roles and responsibilities around feeding and eating. And then 3 times a week, they will have an hour session of physical activity. This was all done in person, but during the COVID-19 pandemic, we switched to a virtual setting. And so these activities are really at the home of those families, and we can really kind of pivot and be flexible to what their needs are, even though we were doing that in person as well. So exercise equipment has been provided to them, to some of them, but most of the physical activity classes are being catered to what they have available and can do at home, which was something very important to us even in person as we were doing these classes. So I think we also provide, a few surveys and questionnaires just to get some information for before and after, because we think it's really important to just make sure that we can be effective as possible for the needs of the community and always be flexible to making some changes like we did in this pandemic. So I hope that kind of helps.
That's fantastic. It's so interesting. Maria, do you have anything to add? Or I'm really interested in what you said about the pivot and the transition to, you know, everybody having to be at home and not being able to gather in together and access the normal, you know, places and even the equipment and the exercise materials. It seems like in some cases we've seen that work really well. In other cases, the barriers are too hard to overcome. So I'm just curious.
So, hi, my name is Maria. I came in actually from maternity leave, and I've been with the program for 10 years. So to come in and after being in the classroom and seeing everything in person, to come in and see them doing everything virtually, honestly, I was impressed. I didn't expect anything less of them, but to really see how easy it was for them to make that switch and to keep the families engaged. I had the opportunity to teach a class actually yesterday, and it's really nice to see how my team has been really able to modify the classes, you know, to decrease the content, because you may not be able to keep someone engaged for an hour. So they've been able to decrease the content to now keep them engaged for still that 1 hour, but with less material, making sure to cover those objectives. I think that has been the most impressive thing, to see the families. And like you mentioned, there's some families that for whatever reason, they were not able to continue with the virtual thing. But now that we have this testimony of this families that continue to be engaged, I think it's going to be it's going to give us great power to encourage the rest of the families come moving forward with this next group, so we can invite them to join and see how, even though we have this barrier, which unfortunately, you know, we can't meet in person, there is still a possibility to feel like a community. Because I think that's one of the things that the program provides, a community of help and encouragement when it comes to staying healthy.
And I would just add, this is Elva, I would just add that, you know, one of the biggest challenges is having that learning curve, not just for the organizations themselves, but also for the participants of the program. So, you know, one of the things that I would highlight in this team is that all of us were willing to go above and beyond, I would say, to just try to make sure that we over accommodate for these families. So although we can't provide them with technology, we interviewed them, we asked them a lot of questions about their capacity to be able to do this, and then provided for the very first week a lot of customer service support. So if we had technical difficulties, our families that are participating were just very patient with that process. And someone else would jump on the phone with them and say, hey, I noticed that you fell off of the call, what's going on? And so since then, since we addressed the potential difficulties that could present themselves, we have had like more of a smooth transition. The families were very open and willing to do it. During the time before we decided to continue on the program, we also were providing a lot of resources from the YMCA, resources of what is going on at St. Joseph's as far as if they can get their medical visits, as well as, you know, workshops to keep them informed, just keep them, hey, we're still here for you, we're still providing you some information. So really took those extra steps to make sure that they were engaged.
I mean, there's that personal connection, that like human interaction that, you know, I think is just so absolutely critical. And whether it's just that being there in that space for those community members, really important. And you don't even, I think you're right, you don't even know what that impact is entirely. So that's fantastic. Well, you guys talked about some of the other questions that we had, but I thought I would ask Jose to introduce himself, but then also talk about kind of from your perspective, what kind of changes as an agency, or you know, what else has this impacted shift of the COVID-19 pandemic been for you?
Oh, you're on mute.
Sorry about that.
No problem.
Jose Herrera with the Valley of the Sun YMCA. I've been with the YMCA, it'll be a little over a year now. And I started with Viva right away when I started with the Valley of the Sun YMCA. So did we skip a question? I just want to make sure. Let me see. You can answer whichever question you want to answer as far as I'm concerned. So let me, I had prepared remarks. I was pretending I was getting an award.
Go for it. Go for it.
Let me make my remarks. So
We're
one of the
very
questions,
casual.
yeah, how do your workers get involved with their job and their community? So for those of you that don't know the YMCA, we're 15 YMCA strong. I'm not including the Skyway camp. So there's 15 throughout Arizona. That includes the Yuma and also Flagstaff, and then one in Pinal County. And the way we get involved is, so every YMCA has their advisory board, and we as executive directors go out and interact with people in the community and try to recruit people that would be good board members for our respective YMCAs. And those board members help us with a variety of things. And one of those things they help us out with is, which is really important, every year we do an annual campaign. Annual campaign helps us to keep providing the services that we offer our members and keep providing financial aid to individuals who need it. And this past year in 2019, 2020, we raised almost 2 million. So
Oh my gosh.
Yeah, almost 2 million. And we were able to do that because of our contacts and our partners that we build. And we have partners here on this phone call that contributed to our campaign. And we're able to do that because of those partners and those relationships as well. And for those of you that don't know, the YMCA has a workforce development program called the Y Achievers. And they work specifically with opportunity youth, mostly out of Maryvale, not exclusively, but about 500 or so a year they work with. And these are what we call opportunity youth from the ages of 16 to 24. And these coaches or career counselors provide these opportunity youth with educational and career related, making sure that they receive or achieve their goals. And these are all free of charge. And we are able to get people recommending us opportunity youth by the connections we build in the community as well. So a lot of the connections we make refer the opportunity youth to our social workers and our caseworkers. And at the Maryvale YMCA, we're able to do a lot of things because of our relationships. We're able to provide free tutoring with our partnerships through GCU for K through 12th grade students. We're able to do health screenings because of our partnerships. And even this past Christmas, because of our relationship with the Vice Mayor's office, we were able to do a holiday celebration. We provided food to the community, gifts to the kids. We even had a visit from Santa Claus. So we're able to do all those things because of our relationships and the things that we do in the community. Like I said, that's partnerships. I think, Leslie, you talked about partnerships and how important they are. And they are to the Y as well, because we wouldn't be able to do Viva without ASU, without Dignity, without St. Joe's. So that's why we partner with these amazing organizations to be able to achieve our goals and reach our members and reach the community and help them out. So, thank you.
Fantastic. And the Y in Maryvale is just such a pillar and an institution. Yeah. And it's incredible, the breadth of what you all do. And again, that human personal touch, really, really important. So Jose, how have you shifted or needed to shift with COVID-19 challenges? And then maybe you can introduce Steve, and Steve can help answer that from a broader perspective too.
So I hope that, Steve, that some of the comments that I'm gonna make, I've shared some of these things that we've done with my colleagues on this phone call and the Zoom meeting. So we closed down on March 18th, I believe. And once we closed down, we decided to pivot and say, okay, so we can't offer, wellness classes, group fitness. We can't even meet for Viva Maryvale in person. So what we started doing is we knew that there's some essential workers that needed their kids that needed to be taken care of. So we started we started out with 9 of our YMCAs that offered emergency childcare with a specific focus on healthcare workers, healthcare professionals, and their children. So we provided about 200 from the time we closed to March 18th, the time we opened on May 13th, we were taking care of about a little more than 200 children a week at the 9.
Wow.
And then we expanded with 13. And obviously, we also provided financial aid. So we provided financial aid to a lot of the families. During this time, we served about a little over 18,000 meals to the kids that we were taking care of. We also did a senior outreach. So we had a lot of members that were what we call older adults, and some of them didn't have family members that were in town. So we were calling these members. We made about, over close to 7,000 calls. I made quite a few of them. So just reaching out to our seniors to see how they're doing, to see if they needed anything, and just keep them engaged. And that made a big difference. Some of the calls I made, they were just super friendly people that appreciated the phone call. Yeah, as soon as they knew who we were, they're like, thank you for calling, we're doing well, and just having a conversation with these individuals. So some of the things that we were doing is that, reaching out to our adult, older adult population. We were still continuing to work with our opportunity youth, not meeting with them in person, but over the phone and also email. I think during that time, they served about close to 500 youth. And we also did workouts. We were doing Zoom workouts. We did about 26,000. Let's see, I think our number is, we worked out with our members more than 26,000 times on Facebook. So that's some of the things that we were doing during this time. And Steve, you want to add anything else?
Yeah, I can add a little bit of the broad things we've been doing. I didn't know if Allison or anyone else would like to talk about delivery of the Viva program itself that had to be changed. Yeah. Before I go into that, would you like to say anything?
Yeah, I don't mind filling in on that part. I think that what Jose is, really stating is, that willingness to really convert. And with our partnership, we really took a step back, and not just for the sake of each individual institution said, the YMCA is, kind of the backbone for this project and this grant. But we all took into consideration what were each of the institutions' needs and what were their directives with this whole pandemic. And so really a lot of the decisions that we've made have not been decisions independent. They've all been with the okay or the moving forward of each of the organization's input, and then most importantly of our participants. And so really, I think I have to congratulate our team, because I think that's what makes it such a successful partnership, is that we've been able to be considerate of each other's institutions and understand that each of our intention is to keep moving forward in the purpose of this project. And so when we stepped back, we said, let's just wait. We're gonna get back in person. This is all gonna, we're all gonna come out of it. And so when time passed, we really got a push, from Allison, our partner at ASU. She's like, we need to get going, and we agreed too. But I think it is that carefulness that we were trying to take, and so we did. We said, okay, let's go. We're gonna go virtually. At St. Vincent and at St. Joseph's, we had already been doing virtual consults. And so we had some experience, and that's where all the expertise comes back in, and all of us just kind of gathered together to make it work. And so virtual is
I'll say, when we first all agreed on the idea, Elle was like, yeah, I think we can do this next week. It's like, what? She's like,
yeah. The tradition, that's why this collaborative works, because either one of us is more cautious or one of us is pushing the envelope, and I think that we're flexible and anyways, and Steve has been so graceful to have joined our team, and just go with the flow, and I think that's also another great pivot to let you kind of talk a little bit about the YMCA.
Sure, thank you. Yeah, my name is Steve Conrad. I'm the grant writer for Valley of Sun YMCA, so I do all the funding for all the programs throughout the state. This one in particular, I was very excited about when I was asked to be the lead agency for the YMCA and help lead the team, but it was absolutely a collaboration. I did want to talk about the steps the YMCA took. Jose mentioned that we did open back up on May 13th. And our primary concern being the health and safety of everyone who comes through our doors, members and non-members. We really took a lot of steps. One being we limit the capacity of the number of people who come into the Y. We close early so that we can do deep cleaning and sanitize everything that people touch. We ask all of our staff to wear masks. We now ask all people coming in to wear a mask as well. So we're really taking a lot of steps to make sure it's a safe place, and we want the Y to always be that safe place that people can come. and have a second space to do all these things.
Yeah, let me say something real quick. When we pivoted to Zoom and then we started talking about the possibility of meeting in person, it's awesome that we talk about things that do we feel comfortable with this, and we make a decision as a group and not individually. And I like working with this group. They've been easy to work with, and just really, I work with a lot of smart people, and that's what I want to work with. People that are way smarter than me, and if I have questions, I'll ask them. And it's just been a great collaboration, and I think it'll stay that way. So, thank you.
It's really it's not something to trivialize. I mean, the power, like the framework and the shared governance, the shared structure you all have is really remarkable. I mean, when you think about these concepts of like, what does resilience look like in a community, or what is what do our structures look like, and both flexibility and fragility are there, and you guys are anti-fragile in that you've created a shared leadership capability, so that when things get thrown at you, you are able to pivot and respond. Anyway, huge props. I can geek out all day. That's phenomenal. So we conclude these things just asking for your advice, your tips, like how, as we go forward, as we've kind of all dealt with what is a really, really crazy time, what are tips, mindsets, advice you would give to people? I'm thrilled to hear it from this group, because you all are the experts in wellness and in health. So I think Elva and Maria are going to take this one, but whoever wants to take it, go for it.
Yeah, I think one of the things that we recommend and that we all try to do is take it one day at a time. So stay present. Stay connected with your family. One of the things that we do in my family is that we do challenges. Like we did a old sock challenge where we needed to create some sort of a doll using an old sock. It was amazing to see everybody come up with the crazy ideas, and even better, the kids were sewing and just doing amazing things. So really staying connected through Zoom, that's how we do it. And then again, taking it one step at a time. We can't look much into the future, just take it one step at a time and stay present.
Yeah, and I would just add that, for our families, that has really resonated. And to add to that is, be mindful of yourself and take care of yourself. So although this is a very stressful time, there is still a need for us to take care of ourselves. And that's kind of what our curriculum and our project really gets families to think about, is how am I going to take care of myself so that my whole family is taken care of, and the legacy of my family continues to be healthy and preventative for chronic diseases. So really that self-care, and I would say for institutions and itself is, it's hard, but be creative, because there are people who need us out there who really need the help. And without our programs, without our services, they really have nowhere else to turn. And we are a sense of, I would say, and I don't mean to boast, but our services are a sense of hope for those families. It gets them out of what would be a worse situation in their mind. And so that's my tip and advice.
Well, is anybody else, anything else you guys want to add before we wrap up?
Yeah, I guess I'll say one thing is that, a piece of advice, stay flexible. I mean, I think everyone
Yes.
on this phone call has been extremely flexible, not only with each other, with our members as well and our participants. And that's, you guys have been extremely flexible, extremely responsive, and I've learned a lot from you guys as well. So I think that's a piece of advice. Thank you.
I just want to add, kind of repeat what everyone has said, that even in health, in wellness, in life, if people are isolated and lonely, that is probably the worst health condition of all. And it's just, Elva and everyone mentioned what an important part of this project is for families to gather together and encourage one another. And we see that too in our work as a team. meeting and encouraging one another, brainstorming, laughing, facing challenges together, and getting outside of your own experience and expectations, and really having this great opportunity to interact and be with others, work together toward a really good goal.
I agree.
Well, this was fantastic. It exceeded all of my, I told you all, I think beforehand, that I'm a fan, but this exceeded all of my expectations. I feel like we could do.
First. You got the best first.
What's that?
You got the best first.
Yes. I mean, this is fantastic. I feel like we could spend an hour with each of you, and maybe we will come back and do that. Well, thanks so much for joining us, and we will see you very soon.
Thank you, Erik.
Thank you, Erik.
Yeah.
Bye.